Iowa CNA Practice Test 2026 Written Exam Review. Question 1. The CNA is caring for an infant in the nursery. Which route is the most accurate for a temperature? Option A, orally. Option B, rectally. Option C, temporally. Option D, axillary. The correct answer is option B, rectally. Explanation. The rectal route is considered the most accurate method for obtaining a core body temperature in infants. Question 2. The patient is lying in the supine position. In what position is the patient's bed? Option A. The head of the bed is 90 degrees. Option B. The head of the bed is flat. Option C. The head of the bed is tilted backward 30 degrees. Option D. The head of the bed is 45 degrees. The correct answer is option B. The head of the bed is flat. Explanation. The supine position refers to the patient lying flat on their back with the bed horizontal. Question 3. The CNA is aware of the importance of meeting emotional needs. Checking on the resident and keeping the call light and reach meets which need? Option A. Quality time. Option B. Sense of purpose. Option C. Safety and security. Option D. Privacy. The correct answer is option C. Safety and security. Explanation. Providing a safe environment and ensuring a way to call for help meets the human need for safety and security. Question 4. The nurse aide is changing a resident's soiled bed linens. Where should the nurse aide place the dirty linens? Option A. On the floor next to the bed. Option B. On the bedside table. Option C. In a leak-proof laundry bag. Option D. On the chair in the room. The correct answer is option C. In a leak-proof laundry bag. Explanation. Soiled linens are considered biohazards and must be placed immediately in a leak-proof bag to prevent the spread of microorganisms. Question 5. A nurse aide is preparing a bed bath. Which action best supports the resident's right to privacy? Option A. Leaving the room door open for ventilation. Option B. Closing the door and pulling the privacy curtain. Option C. Telling the roommate to leave the room. Option D. Explaining the procedure in a loud, clear voice. The correct answer is option B. Closing the door and pulling the privacy curtain. Explanation. Personal care must be conducted in a private environment. Closing doors and curtains is mandatory. Question 6. The nurse aide is caring for an 85-year-old woman with a UTI. Which change associated with a UTI in the elderly would the CNA report to the nurse? Option A. Increased thirst. Option B. Sudden confusion. Option C. Low back pain. Option D. Darker urine. The correct answer is option B. Sudden confusion. Explanation. In the elderly, classic symptoms of infection are often absent. Sudden onset of confusion is a frequent indicator of a UTI. Question 7. The CNA is turning a patient during rounds. What is the best way to ensure the Foley catheter is not pulled out? Option A. Ensure the catheter is secured to the inner thigh. Option B. Hang the Foley bag on the bed frame. Option C. Tell the patient to hold the bag. Option D. Tape the Foley catheter to the outer thigh. The correct answer is option A. Ensure the catheter is secured to the inner thigh. Explanation. The catheter should be secured to the resident's leg to prevent tension on the urethra during movement. Question 8. The patient who is bedbound is at risk for which of the following? Option A. Dysphagia. Option B. Polydipsia. Option C. Atrophy. Option D. Neck paralysis. The correct answer is option C. Atrophy. Explanation. Atrophy is the wasting away of muscle tissue due to lack of use, which is a risk for patients with limited mobility. Question 9. Which of the following happens when a patient has a stroke? Option A. The patient urinates themselves. Option B. The patient may foam at the mouth. Option C. The patient may roll their eyes back. Option D. The patient may have drooping of one side of the face. The correct answer is option D. The patient may have drooping of one side of the face. Explanation. A common and immediate sign of a stroke is hemiplegia, often visible as unilateral facial drooping. Question 10. Which of the following represents the correct size for a blood pressure cuff? Option A. Width is approximately 95% of arm circumference. Option B. Width is approximately 25% of arm circumference. Option C. Width is approximately 40% of arm circumference. Option D. Width is approximately 10% of arm circumference. The correct answer is option C. Width is approximately 40% of arm circumference. Explanation. For an accurate reading, the blood pressure cuff bladder width should be approximately 40% of the arm circumference. Question 11. The aide is caring for a patient who says, "I overheard the nurse telling my roommate he has cancer. Is he going to be okay?" How should the aide respond? Option A. His condition is confidential. I cannot share information. Option B. Tell your patient what type of cancer his roommate has. Option C. You should ask his nurse what is wrong with him. Option D. Ask your roommate's family member about his diagnosis. The correct answer is option A. His condition is confidential. I cannot share information. Explanation. Under HIPAA regulations, a nurse aide cannot disclose the medical information of one resident to another. Question 12. The CNA witnesses a resident screaming at a coworker. What should the aide do next? Option A. Yell at the resident to stop. Option B. Call the charge nurse. Option C. Apply restraints. Option D. Nothing, it is not your problem. The correct answer is option B. Call the charge nurse. Explanation. Behavioral issues and verbal aggression should be reported to the charge nurse for appropriate intervention. Question 13. Contact precautions include which of the following? Option A, mask, gown and gloves. Option B, gloves and gown. Option C, mask, gown, gloves and face shield. Option D, mask, gown, gloves and shoe covers. The correct answer is option B, gloves and gown. Explanation. Standard contact precautions require the use of a gown and gloves to prevent spread via touch. Question 14. The CNA found unlabeled pills on the resident's nightstand. What is the CNA's next step? Option A, provide water and insist the resident take them. Option B, discard them. Option C, leave them alone to respect confidentiality. Option D, notify the nurse immediately. The correct answer is option D, notify the nurse immediately. Explanation. Any unidentified medication is a safety hazard and must be reported to the nurse immediately. Question 15. A resident wants a copy of their medical records. The CNA should. Option A, make a copy and give it to them. Option B, inform them that copies cannot be given. Option C, notify the resident's family about the request. Option D, provide the record release forms and advise the supervisor. The correct answer is option D, provide the record release forms and advise the supervisor. Explanation. Residents have a legal right to their records, but the process must be handled by administrative supervisors. Question 16. The care plan indicates a client should be repositioned every 2 hours when in bed. What is the reason for this? Option A, increase client comfort. Option B, provide the opportunity to check in. Option C, decrease fall risk. Option D, prevent skin breakdown. The correct answer is option D, prevent skin breakdown. Explanation. Frequent repositioning is necessary to prevent prolonged pressure, which leads to tissue ischemia and skin breakdown. Question 17. The CNA is performing CPR with a second rescuer. At what rate should CPR be performed? Option A, 100 to 1. Option B, 30 to 2. Option C, 15 to 2. Option D, 45 to 1. The correct answer is option B, 30 to 2. Explanation. For an adult with 2 rescuers, the compression to ventilation ratio remains 30 compressions to 2 breaths. Question 18. A resident tells you she cannot eat a meal because of her religious beliefs. What is your next step? Option A, tell her the kitchen is closed and she must wait. Option B, tell the resident to call a family member for food. Option C, contact the nurse and assure her you will bring a correct tray. Option D, tell the patient to call a pizza delivery service. The correct answer is option C, contact the nurse and assure her you will bring a correct tray. Explanation. Respecting religious dietary restrictions is part of person-centered care. The Aide should facilitate a replacement meal. Question 19. If asked to sign a residence, will the CNA should? Option A, agree but refuse any compensation. Option B, decline and notify the nurse. Option C, arrange for case management to assist. Option D, tell the resident a family member must sign. The correct answer is option B, decline and notify the nurse. Explanation. Aides should not involve themselves in the legal or financial affairs of residents to avoid conflict of interest. Question 20. The CNA is assisting a client on swallowing precautions. Which should be included in the plan of care? Option A, client should not be left unattended when eating. Option B, give the client the regular dietary menu. Option C, instruct the client to tip their head back to swallow. Option D, no additional precautions are needed for soft foods. The correct answer is option A, client should not be left unattended when eating. Explanation. Patients with swallowing difficulties are at high risk for aspiration and should never be left alone while eating. Question 21. Which activity can be completed by a nurse aide? Option A, administering intravenous medication. Option B, dressing a wound. Option C, assisting with bathing. Option D, assess change in mental status. The correct answer is option C, assisting with bathing. Explanation. Nurse aides are trained to assist with activities of daily living such as bathing. Meds and assessments are outside their scope. Question 22. Which of the following interventions should the CNA use to promote skin integrity? Option A, pad bony prominences when in bed. Option B, leave TED stockings on during the night. Option C, provide the client with additional blankets. Option D, slide the client up to reposition them. The correct answer is option A, pad bony prominences when in bed. Explanation. Padding bony prominences reduces direct pressure on areas like the sacrum and heels to prevent ulcers. Question 23. A resident is hitting and kicking the 2 CNAs who are trying to provide care. What is the next step? Option A, tie the patient's hands to the bed with towels. Option B, yell for the nurse to bring a sedative. Option C, one CNA stays in a safe place and the second CNA gets help. Option D, tell the patient they better stop hitting and kicking. The correct answer is option C, one CNA stays in a safe place and the second CNA gets help. Explanation. If a resident becomes combative, the aide should ensure safety, stop care and seek assistance from the nurse. Question 24. The resident refuses to eat vegetables with meals or as snacks. The CNA should. Option A, sit with them until they eat a small portion. Option B, have dietary increase the amount of vegetables. Option C, notify the nurse so nutrition can be evaluated. Option D, hold all desserts until they eat vegetables. The correct answer is option C, notify the nurse so nutrition can be evaluated. Explanation. Persistent refusal of food groups can lead to malnutrition. The aide's role is to report the behavior for assessment. Question 25. The CNA was unable to empty a urinary bag until the end of a 12-hour shift. Which amount emptied should be reported immediately? Option A, 1,000 milliliters. Option B, 600 milliliters. Option C, 2,100 milliliters. Option D, 350 milliliters. The correct answer is option D, 350 milliliters. Explanation: normal urine output should be at least 30 milliliters per hour. Over 12 hours 350 milliliters is significantly low. Question 26. The CNA is performing CPR on an adult patient. At what rate should compressions be performed? Option A, 100-120 per minute. Option B, 60-100 per minute. Option C, 80-120 per minute. Option D, 120-160 per minute. The correct answer is option A, 100-120 per minute. Explanation: current AHA guidelines specify a compression rate of 100 to 120 compressions per minute for an adult. Question 27. The CNA is caring for a patient receiving end-of-life care. Which task is appropriate? Option A, range of motion exercises to increase strength. Option B, providing optimal comfort to the patient and family. Option C, activities and games to prevent forgetfulness. Option D, keeping meals on a regular schedule. The correct answer is option B, providing optimal comfort to the patient and family. Explanation: end-of-life care focuses on the quality of life and providing comfort for the patient and their loved ones. Question 28. A resident wanders into other residents' rooms at night. What should the nurse aide answer the family? Option A, I will put a belt restraint on him. Option B, I will use the linen cart to barricade the path. Option C, I will ask the nurse for sleeping pills. Option D, I will ask the nurse if we can get a sitter to stay with him. The correct answer is option D, I will ask the nurse if we can get a sitter to stay with him. Explanation: continuous supervision is the safest and least restrictive intervention for wandering. Question 29. The nurse aide is caring for a patient with stress incontinence. What is necessary for this patient? Option A, a Foley catheter to keep the skin dry. Option B, frequent toileting breaks throughout the day. Option C, less fluids to keep them from urinating. Option D, diuretics to help keep the bladder empty. The correct answer is option B, frequent toileting breaks throughout the day. Explanation: stress incontinence can be managed by scheduled toileting to keep the bladder empty and reduce accidents. Question 30. A nurse aide enters a room without knocking while you are providing care. What is the best response? Option A, please knock next time to respect the patient's privacy. Option B, say nothing to avoid a conflict. Option C, you should have knocked first. Option D, say to the resident she is always rude like this. The correct answer is option A, please knock next time to respect the patient's privacy. Explanation: aides have a duty to protect resident privacy. Reminding a coworker to knock is a professional way to enforce standards. Question 31. The nurse aide is assigned to measure a resident's urinary output from the Foley catheter. Which action is most important to prevent the spread of infection? Option A, hold the drainage bag above the level of the bladder. Option B, wear gloves and clean the drainage tube after use. Option C, place the measuring container on the floor under the bed. Option D, rinse the measuring container with cold water before use. The correct answer is option B, wear gloves and clean the drainage tube after use. Explanation: standard precautions in cleaning the drainage port prevent the introduction of bacteria into the closed urinary system. Question 32. Which should be included when repositioning a patient higher in the bed? Option A, lower the height of the bed to the lowest position. Option B, raise the head of the bed. Option C, lower the head of the bed. Option D, grasp the client under the arms and pull. The correct answer is option C, lower the head of the bed. Explanation: lowering the head of the bed to a flat position makes it easier to move the patient upward and reduces physical strain. Question 33. A pulse oximeter is a medical device used to measure. Option A, the level of carbon dioxide in the blood. Option B, the percentage of oxygen in the blood. Option C, the depth and rate of respirations. Option D, the pressure within the arteries. The correct answer is option B, the percentage of oxygen in the blood. Explanation: a pulse oximeter measures oxygen saturation, which is the percentage of hemoglobin saturated with oxygen. Question 34. The nurse aide is assigned to measure a resident's height. The resident is unable to stand. What should the aide do? Option A, estimate the height by looking. Option B, use a tape measure to measure length in bed. Option C, wait until the resident is strong enough to stand. Option D, ask the family what the height was last year. The correct answer is option B, use a tape measure to measure length in bed. Explanation: if a resident is bedbound, height should be measured using a tape measure while the resident is lying flat. Question 35. A client's blood pressure measure is 200/180 but they appear stable and are not in distress. What should the CNA do next? Option A, ensure the blood pressure cuff is the correct size. Option B, document the blood pressure and finish other vitals. Option C, immediately notify the nursing supervisor. Option D, tell the client their blood pressure is too high. The correct answer is option C, immediately notify the nursing supervisor. Explanation: a blood pressure of 200/180 is a hypertensive crisis. It is a medical emergency that must be reported immediately. Question 36. What is the proper measurement for measuring bodily fluids? Option A, ounces. Option B, liters. Option C, milliliters. Option D, fluid ounces. The correct answer is option C, milliliters. Explanation: milliliters, ml, is the standard metric unit used in healthcare for the precise documentation of intake and output. Question 37. Which is the best way to take an apical pulse? Option A, to the right of the sternum under the clavicle. Option B, on the back at the fifth intercostal space. Option C, right of the sternum at the fifth intercostal space. Option D, left of the sternum at the fifth intercostal space at mid-clavicular line. The correct answer is option D, left of the sternum at the fifth intercostal space at mid-clavicular line. Explanation: the apical pulse is measured using a stethoscope placed at the fifth intercostal space at the mid-clavicular line on the left side. Question 38. The aide is caring for a patient on strict dysphagia precautions. The cafeteria sent her up a lunch tray. What item would the aide question if it arrived on the patient's tray? Option A, regular orange juice. Option B, mashed potatoes. Option C, oatmeal. Option D, applesauce. The correct answer is option A, regular orange juice. Explanation: dysphagia indicates difficulty swallowing. Thin liquids like regular orange juice are high choking risks and require thickening agents. Question 39. You are performing CPR on an adult patient. What is the correct depth per compression? Option A, 1 inches. Option B, 2 inches. Option C, 1.5 to 2.5 inches. Option D, 2.5 to 5 inches. The correct answer is option B, 2 inches. Explanation: for an adult, chest compressions must be at least 2 inches deep to effectively circulate blood to the brain. Question 40. You are assisting a diabetic patient with eating and he only finished 25% of his meal. What should you do? Option A, report this to the nurse in charge. Option B, nothing, the patient may not be hungry. Option C, tell the patient they must eat more. Option D, chart the patient ate 25% of the meal. The correct answer is option A, report this to the nurse in charge. Explanation: diabetic patients require consistent carbohydrate intake to balance insulin. Low food intake must be reported. Question 41. The nurse aide observes a resident sweating, feeling dizzy and appearing anxious. What is the first step? Option A, call for the nurse immediately and stay with the resident. Option B, offer the resident a glass of water. Option C, help the resident brush their teeth. Option D, leave the room to find a glucose monitor. The correct answer is option A, call for the nurse immediately and stay with the resident. Explanation: sweating and dizziness are signs of a serious medical issue. The aide must stay with the resident and summon help. Question 42. Which of the following is the best way to prevent the spreading of germs? Option A, wearing gloves during patient care. Option B, wearing a mask and gloves during patient care. Option C, hand washing before and after patient care. Option D, wearing a gown, mask and gloves while performing patient care. The correct answer is option C, hand washing before and after patient care. Explanation: hand washing is the single most effective method for preventing the transmission of pathogens and cross-contamination in healthcare settings. Question 43. The nursing assistant is caring for a patient who is a two-person transfer assist. She plans on using a Hoyer lift because she is in a hurry. The assistant brings the lift into the room and the resident asks, "Are you going to get someone to help you?" What should the assistant tell the patient? Option A, "No, I am in a rush, you will be okay." Option B, "Yes, I will get another CNA to help. Your safety comes first." Option C, explain to the patient that you will be extremely careful. Option D, tell the patient you will get help but it will take a while. The correct answer is option B, "Yes, I will get another CNA to help. Your safety comes first." Explanation: facility safety protocols for mechanical lifts almost always require 2 staff members. The aide must prioritize the patient's safety over their own schedule. Question 44. The CNA witnesses a nurse giving milk to a patient with a milk allergy. What is the CNA's next action? Option A, nothing, it is not your concern. Option B, report this to the nursing supervisor. Option C, yell loudly for the nurse to stop. Option D, tell the patient that you are sorry. The correct answer is option B, report this to the nursing supervisor. Explanation: the aide has an ethical and legal duty to report any unsafe practice to a supervisor to protect the patient. Question 45. A resident is acting out and having behavioral disturbances. What should the assistant do first? Option A, encourage the family to move the resident. Option B, provide for patient and staff safety. Option C, isolate the resident from others. Option D, call the police to pick up the resident. The correct answer is option B, provide for patient and staff safety. Explanation: in any situation involving behavioral disturbances, the primary responsibility is to ensure a safe environment for everyone. Question 46. A resident tells the aide they have a decision to make about a personal issue. What is the best way to respect independence? Option A, suggest legal counsel. Option B, actively listen to the resident. Option C, ask them to speak with the social worker. Option D, encourage them to listen to their family. The correct answer is option B, actively listen to the resident. Explanation: active listening supports the resident's autonomy and allows them to process their own decisions. Question 47. The CNA is aware that the resident is sleeping more than usual and has a lack of interest in once loved activities. These are signs of which disorder? Option A, anger. Option B, depression. Option C, frustration with staff. Option D, Alzheimer's disease. The correct answer is option B, depression. Explanation: withdrawal and loss of interest are classic clinical signs of depression in the elderly. Question 48. A resident's room is sloppy and the resident will not tidy up. The CNA should: Option A, clean the room while the resident is away. Option B, insist the resident put things away or they will be tossed. Option C, explain that some items are a safety hazard and help relocate them. Option D, notify the power of attorney. The correct answer is option C, explain that some items are a safety hazard and help relocate them. Explanation: clutter is a fall hazard. The aide should explain the risk and work with the resident to organize the space. Question 49. The nurse aide is assisting a resident with ambulation. This patient uses a cane for ambulation. How should the nurse aide assist this patient? Option A, stand on the same side as the cane. Option B, stand on the patient's weaker side. Option C, stand behind the patient in case they fall. Option D, walk backward in front of the patient. The correct answer is option B, stand on the patient's weaker side. Explanation: when assisting with ambulation, the aide should stand on the patient's affected weaker side to provide support and balance. Question 50. The nursing assistant is caring for a patient who is on a bowel regimen and has not had a bowel movement in 4 days. What is the assistant's next step? Option A, report this to the nurse in charge. Option B, give the patient orange juice with Miralax. Option C, encourage the patient to drink more water. Option D, nothing, this is normal. The correct answer is option A, report this to the nurse in charge. Explanation: a change in bowel habits or a lack of bowel movements for several days is a significant finding that must be reported to the licensed nurse. Question 51. A resident is refusing a shower and has not had one in 3 days. How would you respond? Option A, tell him he must take a shower so you do not get in trouble. Option B, tell him you will call his daughter. Option C, gently force him into the bathroom. Option D, explain it is his right to refuse and you can try again tomorrow. The correct answer is option D, explain it is his right to refuse and you can try again tomorrow. Explanation: residents have the legal right to refuse care. The aide should respect the refusal and offer again at a later time. Question 52. A resident's family member provided a pornographic magazine. The CNA should: Option A, remove the magazine and discard it. Option B, ask them to keep it in their room to avoid offending others. Option C, take it to a supervisor. Option D, encourage them to watch videos on the internet. The correct answer is option B, ask them to keep it in their room to avoid offending others. Explanation: residents have a right to possess personal items but should be encouraged to keep them in their private room out of respect for others. Question 53. A coworker asks for help lifting a resident who has fallen but does not explain how it happened. What is the best action? Option A, help the coworker lift the resident. Option B, ask the resident if they are in pain before moving. Option C, stay with the resident and tell the coworker to get the nurse. Option D, wait until the resident is back in bed to report. The correct answer is option C, stay with the resident and tell the coworker to get the nurse. Explanation: a resident who has fallen must be assessed by a nurse for fractures or head injuries before being moved. Question 54. The aide notices a patient has multiple bruises in different stages of healing. What is the next step? Option A, report possible abuse to the abuse hotline. Option B, report your findings to the nurse. Option C, report the possible abuse to the police. Option D, report the bruises to the patient's family. The correct answer is option B, report your findings to the nurse. Explanation: nurse aides are mandated reporters. Any signs of potential abuse must be reported immediately to the nurse in charge. Question 55. What is one reason why performing postmortem care is essential? Option A, there is no need to perform care. Option B, performing care ensures the staff feel good. Option C, one reason care is essential is that it is legally required. Option D, care is important to maintain the dignity and respect of the patient. The correct answer is option D, care is important to maintain the dignity and respect of the patient. Explanation: postmortem care is provided to show respect for the deceased and to provide a clean and peaceful appearance for the grieving family. Question 56. 2 unmarried adult residents are cuddling in the common area. They are content and not bothering anyone. The CNA should: Option A, separate them. Option B, escort them to a private room. Option C, notify their families. Option D, allow them to enjoy each other's company. The correct answer is option D, allow them to enjoy each other's company. Explanation: residents have a right to consensual social and romantic relationships as long as it does not infringe on others. Question 57. The CNA understands that elderly residents volunteering or exploring hobbies provides which of the following? Option A, gives a sense of purpose. Option B, respects privacy. Option C, makes the person feel younger. Option D, prevents depression. The correct answer is option A, gives a sense of purpose. Explanation: maintaining social engagement provides elderly residents with a sense of purpose and self-worth. Question 58. Which task is correct foot care for a diabetic patient? Option A, giving the patient a heating pad for his feet. Option B, soaking his dry feet in a warm tub daily. Option C, keeping his feet dry and warm with clean socks. Option D, ensuring his toenails are always clipped short. The correct answer is option C, keeping his feet dry and warm with clean socks. Explanation: diabetic patients often have poor circulation. Keeping feet clean and dry is essential to prevent infections. Question 59. Which of the following is an example of subjective information? Option A, the patient's pain level is 7/10. Option B, the patient's temperature is 101.2. Option C, the patient's respirations are 18 beats per minute. Option D, the patient's blood pressure is 120/80. The correct answer is option A, the patient's pain level is 7/10. Explanation: subjective information is based on what the patient reports and cannot be independently measured by the aide. Pain is always subjective. Question 60. Bed-making technique includes eliminating wrinkles in the sheets. The CNA knows this technique assists to: Option A, prevent pressure sores. Option B, ensure the client is warm. Option C, minimize the need to remake the bed. Option D, provide improved hygiene. The correct answer is option A, prevent pressure sores. Explanation: wrinkles in bed sheets create friction and uneven pressure, which are leading causes of skin breakdown.